Hello everyone, it's Dr. Mura again. Thank you for joining us. This day 6 in isolation. This is after we came down with the COVID-19, and we're so grateful that we are all doing well. I personally didn't have much symptoms. I wouldn't have even known that I had COVID-19 had not been for my brother who got sick, and then we all got tested. I just had about 2 days or so mild headaches. That was it. Otherwise, I've been doing great. My kids and my wife, they're doing well, and my brother as well improved very well, and our nanny is doing great. So we thought we'd be doing this to encourage other people that may be going through the same experience, but also to share the light, a little bit knowledge, information about this pandemic, of what we have learned so far. If you'd like to check out the previous updates, if you missed any one of those, you can find them at our Facebook page at Dr. Mura Health, or you can actually go to our website drmurahealth.com. We would just want to thank you again for always praying for us, and your support really means much to us. Today I just want to talk something that is very, very close to my heart, and probably trying to be of help as well, because there's so much fear when it comes to this COVID-19. The fear, which is legitimate, by the way, and I don't like people who downplay this, that people who don't think it's nothing. But if you have lost your loved ones, or you have really looked after a patient drowning in their own lungs and being helpless, you really understand this is real. Having said that, though, I think I'll be doing you a disservice as a doctor if I don't put things in perspective, and seeing what's also going outside, because now the focus has been on COVID-19, which is makes sense. I mean, we've lost so far more than 7,000 lives in the country. It makes sense. But having said that, when you talk about and look about at other modifiable things that we can do, I think, for example, non-communicable diseases. For example, when you check the Medical Research Council of South Africa started talking about, in 2016 alone, about 260,000 people died of non-communicable disease. Those are things like hypertension, diabetes, something that we can control, and not only control, can even reverse with doing with a lifestyle. Now, so I'm not trying not to say that COVID-19 is not important. It is. Actually, I'm driving this point home, that those two, and by the way, I think that was 2016. I don't think things got any better, but it got worse, I would like to believe. So those are 260,000 lives, South African, that die every year. So I'm driving this point at home, saying that those 260,000 people will die this year as well if we don't do something. But now they're actually going to die quicker, because they have this modifiable risk that put them even vulnerable to this SARS-CoV-2 virus. So, for example, if you have a hypertension, you have twice the odds of having severe COVID-19. If you have a cardiovascular disease, you have 3 times the odds of having severe disease. If you have both cardiovascular and hypertension, you have 4 times the odds. If you have chronic lower respiratory tract disease, such as COPD or emphysema, you have about 18 times the odds of end up intubated in ICU. And these are the things that we can do about it. So what about type 2 diabetes? Type 2 diabetes is a major risk factor. I mean, not only with this SARS-CoV-2 virus, but also with the previous coronaviruses, such as SARS, severe acute respiratory syndrome, and MERS, Middle East syndrome disease. And those people with those previous outbreak, this diabetic people were affected severely. But there is something that we can do. When you think about how many people die every year, by the way, I'll talk about South Africa. According to the WHO, 41 million people die every year around the world due to non-communicable diseases. That is about 71% of all causes of death, just from non-communicable disease. And there's something that can be done. And actually, there is this article that I want to just share with you that I was reading, talking about these. I don't know if you can see this, but when I sent this, when I put this below anyway, so that I can read it for you at your own time. But this is from Metabolism, Clinical and Experimental. This is a new study. The title of this study, basically, we're talking about mechanisms of increased morbidity and mortality of SARS-CoV-2 infection in individuals with diabetes. What this means for effective management strategy. So they said that yes, we have this, but there's something that it can do to improve people's metabolic status. And here I'm reading from here. It says that fight, however, what we can do is not going to be won with a Clorox or a Purell or mask or anti-inflammatory drugs. The fight will only be won through a serious commitment to improving everyone's fundamental metabolic health, starting with the lowest hanging evidence-based fruit, that is dietary and lifestyle interventions. We can win this war. I got this COVID-19, but I'm not afraid because I know with what we know, I don't have the risk factor that it push me to other side. But there is, even if you have this risk factor, we can do something to change that. And it continues saying, it says that importantly, talking about how this COVID-19 behaves, importantly, the standard Western diet is known a driver of similar pro-inflammatory signature to that seen in severe COVID-19 physiology. And consuming health foods can help can have a rapid anti-inflammatory effect. And then this is what they recommend. Consuming fresh, fiber-rich whole foods could serve to mitigate some of the overwhelming immune response that appear to be compounded in patients with the COVID-19 who have diabetes and obesity. And this must be a central focus included in any clinical recommendation made to patients or healthcare system during this pandemic. Again, coming to the healthy lifestyle, eating food that are really real, can change the outline of our life. So what about obesity? Obese people are prone to this issue. I mean, for example, talking about if you have people that are with a severe BMI, if a BMI is more or equal to 35 kilogram per meter square, you have a 7 odds of having severe COVID-19 disease. But it's not just obesity, even though just who are overweight. That is like a BMI like a 28 kilogram per meter square. You have a 60 times of having a severe COVID-19 disease. And these are the things that you can do. But you're talking about obesity. Do you know how many? Do you know how many people are obese in South Africa? It's that has been done. In South Africa, 29.2% of men are obese or overweight. And guess, do you know the number for women? 56.6% of South African women are obese or overweight. Now that gives you perspective, we can mitigate, we can reverse all this thing and be able to fight back this virus. And not only that, again, just another quick study here. This is talking about the impact on nutrition. Again, we're going to see on the below the link, talk about the impact of nutrition on COVID-19 susceptibility and long-term consequences. This basically it says here, now more than ever, wide access to health foods should be a top priority, and individuals should be mindful of health eating habits to reduce susceptibility and long-term complication of COVID from COVID-19. Yes, we need that drug that can make things quick and done. But before that, and there's still much that can be done. So this, I thought, it can encourage you not to know that there's nothing that you can do something. The more you reduce your risk factors, the more you put yourself in a better position to fight this disease. That is why here at Dr. Mura Health, we decided to do something special. We're offering 7 days of free evidence-based lifestyle medicine online class for people who wanted to change their lifestyle, to stop and reverse this risk risk factors, some of which I just mentioned. This is for free, and of course we don't we don't have a big class to be doing this, and we don't know how long this this offer is with us. But if you see this offer, please you should click on the link, and so that you can learn more. Even if you don't have any of these risk factors, you can learn how to prevent, and you can learn for your loved ones this critical information that that is more than before is very necessary and important. So COVID-19 disease, yes, we're still trying to find out what is the really treatment of which we don't have yet, but there is much more we can do to be able to stay healthy during this this pandemic. I hope this helps, and thank you so much. God bless.